Welcome everyone, and thank you for joining us for the webinar today. My name is Gina Breinig, and I work in the health promotion department at the Health Plan. We believe each person's well-being is multidimensional, going beyond just physical health, which is why our wellness program focuses on 8 dimensions: emotional, environmental, social, spiritual, personal and professional, nutritional, financial, and physical. We're excited to offer a number of short educational videos on these dimensions and hope you're able to gain new knowledge and motivation to help you continue on your own journey to optimal well-being. Before we get started today, first some housekeeping items. We have everyone in listen-only mode for the best sound quality. There is a chat feature you can use to submit any questions, and we'll take all the questions and send them out with responses to everyone after the webinar. This webinar is also being recorded, so for those of you who are listening to the recording, there's an email at the end of the presentation where you can submit any questions. And now I'd like to introduce our speaker today, Jenny Gruber, AP-NP, who will be speaking about cervical health. Jenny has a master's degree in nursing and is a family practice nurse practitioner through American Nurses Credentialing Center. She's worked in the healthcare industry for 18 years. Her background and special interests include women's health, OB, occupational health, and opioid use disorder. So thank you, Jenny, for sharing your information today on this topic.
Thank you for the introduction. So today we're going to talk about or discuss cervical cancer awareness. January is Cervical Cancer Awareness Month. We have come a long way with this cancer. It used to be a leading cause of death for women over the past 40 years, this number has dramatically decreased and it's continuing to decrease. In 2017, there was only 166 cases of cervical cancer in Wisconsin. The rates of cervical cancer diagnosis and cancer deaths are impacted by changes in exposure to risk factors, screening, test use, and improvements in treatments. Presentation overview. So we're going to briefly look at the anatomy of the female anatomy. We're going to talk about HPV, which is that sexually transmitted virus that causes many cervical cancers, screening, risk factors for cervical cancer, prevention, and signs and symptoms, and when do we stop doing cervical cancer screenings. So here is a picture of the female anatomy, and the cervix is between the vagina and the uterus. It's actually the Latin word for it, or the cervix is the Latin for neck of uterus, because it kind of does look like the uterus is sitting on the neck here of the cervix. It's approximately only 2 to 3 centimeters in length. Screening methods. So there is a pap smear and also HPV, which is a human papilloma virus test. These screening methods are done by using a small brush. Here's one of the brushes that we can use. Small brush that obtains cells on the cervix, and then they are examined under the microscope. For women, it can create an uncomfortable cramping sensation in the lower abdomen. The PAP is looking for abnormal cells, and the HPV is looking for that sexually transmitted virus that causes many cervical cancers. So your provider may do a PAP only, an HPV only, or both of them at the same time, depending on your age and your past results. Ages for screenings for cervical cancer. Pap smears start at the age of 21. These are usually repeated every 3 years up until the age of 29. At the age of 30, most providers will do co-testing, which means doing a pap smear and HPV screening. And if both of these are negative, this test is done every 5 years. If there are abnormal test results, then there will be more frequent screenings as well as other procedures that your provider would discuss with you in detail. When to stop cervical cancer screening. So cervical cancer screening, generally we can talk about discontinuing it after the age of 65, unless the patient had a recent precancer or cancerous lesion of the cervix, vagina, vulva, or anus. in which we would continue to do Pap screening or cervical cancer screening. Those who have HIV infection, we continue to screen. Those with DES exposure in utero. So the DES drug was given to women prior to 1981 to prevent pregnancy complications. And we've learned that those who are exposed in utero, there is an increased risk of cervical cancer. So we'll continue doing cervical cancer on these individuals as well. We can also stop doing cervical cancer screenings after a hysterectomy. If you've had a hysterectomy, they likely remove the cervix, as this is part of the uterus. However, if the hysterectomy was done because of cervical cancer, then we will need to do vaginal PAPs are recommended. So HPV, this is the most important risk factor for cervical cancer. 80% of women are exposed to this virus. HPV can cause cervical, vulvar, vaginal cancer in women, and it also can cause penile cancer in men and anal cancers in both genders. There's over 100 different types of strains of HPV, from low risk to high risk. Low risk type genital are usually in the form of genital warts, and these rarely cause damage to the cervix. High risk strains for HPV have a greater likelihood of causing cancer, and particularly the strains of number 16 and 18. So many times the immune system works to rid the virus before it does any harm. And you can do this by keeping yourself healthy. I think we'll talk about that in the next slide. How is HPV spread? So HPV is spread not only through intercourse, but also skin to skin contact. The more partners, it increases your risk of exposure. Condoms offer partial protection, as it just needs to have contact with the skin. It is not spread through touching things like toilet seats. There really is no signs or symptoms of the infection, and most of the time the infection will resolve within a couple years, although 10 to 20% of the time the virus persists, and this is what increases the chances of getting cervical cancer. So symptoms of cervical cancer can include back pain, abnormal vaginal bleeding, or unusual vaginal discharge, bleeding or pain with intercourse, unexplained weight loss, joint pain, and bladder discomfort. How can I decrease my risk of developing cervical cancer? So stopping smoking. Smoking weakens the immune system, and it makes it very hard for your body to fight the infection. So stopping smoking, the HPV vaccine, which we'll talk about, I believe, in the next slide, and get recommended screenings. The good news is that it takes many years for the HPV infection for cervical cancer to develop. So if you're getting regular screenings, it is likely that we will detect it early and successfully treat it. And then HPV vaccination. So these are recommended for children between the age of 11 and 12 years old. If the first HPV vaccine is given before 15 years of age, then they only need 2. If it's after 15, then they'll need 3 doses. This vaccine can prevent some types of HPV strands, and it's important to give this vaccine early in childhood, because we want this to be done before your children become sexually active. And those who are 26 years and older will likely not benefit from the vaccine, and this is because if they're sexually active, they have likely already been exposed to the HPV virus. Common reactions to the HPV vaccination include soreness, redness, swelling, where the shot is administered. And thank you for attending, and I hope you learned something new today.
Thanks, Jenny, for that great information, and I hope you learned something new. And thank you again for attending. Have a great day. Thank you.